The number of coronavirus cases being identified around the country is fast rising, the result of both the spread of the disease and better testing. But much more concerning is the rising death toll, with more than 2,800 in the U.S., according to Johns Hopkins University. Here in Massachusetts, there were more than 5,700 cases as of this afternoon and 56 deaths. A few hours before those numbers came out, Governor Charlie Baker announced that cases here are expected to peak in the next 2 to 3 weeks, but help should be on the way, as the federal government just approved a request for at least 1,000 more ventilators.
Getting an answer on that in less than 2 days, with an assumption that those will be here sometime by between now and the end of the first week in April, was a big positive step forward in the right direction. But we continue to chase PPE through a whole variety of alternative supply chains. I'll feel a lot better about that ability to actually deliver on a confirmed order when one shows up.
As I'm sure will local hospitals, where medical staff are already starting to feel the crush of additional patients and the illness of many of their colleagues. In other areas of the country, hospitals are barely able to keep up. Some in New York have been described as medical war zones, like this one in Brooklyn, where patient beds line the hallways and the morgue is reportedly overflowing. A few hours ago, a Navy hospital ship arrived in New York to help treat non-coronavirus patients. Field hospitals are also being set up in New York, Louisiana, Illinois, and elsewhere, ready to treat as many people as possible. And the president, meanwhile, has been helping out by inexplicably accusing hospitals and medical staff of hoarding.
We do have a problem of hoarding. We have some healthcare workers, some hospitals, frankly, individual hospitals and hospital chains. We have them hoarding equipment, including ventilators. Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? How do you go from 10,000 to 300,000? And we have that in a lot of different places. So somebody should probably look into that.
There are a lot of things we should look into, but in my inexpert opinion, that is not one of them. I'm joined now via Skype by Dr. Paul Biddinger. He's chief of the Division of Emergency Preparedness and director of the Center for Disaster Medicine at Mass General Hospital. Doctor, thank you so much for joining us. I appreciate it.
Thank you, Jim.
So you mapped out for NBC News the best and worst case scenarios, but you proceeded to say we are on a trajectory for the worst case scenario. What do you mean by that, doctor?
Well, so we have a team here at the hospital that help us model our cases that we see in the emergency department, that we admit to the hospital, that we admit to the intensive care unit, and we map that against previous curves we've seen elsewhere in the world, like in northern Italy and elsewhere. And really, obviously, the northern Italian situation that everyone's familiar with is what we consider a worst case. And it's possible that we may see cases, both in terms of numbers and critical illness, that look a lot like that kind of a scenario.
How are you doing so far today? The governor said the peak is likely to be between the 7th and 17th of April, but I read in that same NBC News report, you're already, I don't know if raiding is the appropriate verb, but you're already going to this emergency warehouse you have outside Boston for some supplies you're running short on.
Yeah, I would probably say utilizing, not raiding.
Thank you. Okay.
But no, it's absolutely, it's a huge concern. I mean, since January, we have seen orders of personal protective equipment that we've placed from our suppliers not filled either completely or at least at lower levels. And of course, we have higher utilization given everything we need to protect our healthcare workers from this disease. So it's absolutely concerning that we're using so much.
Haven't you ordered or directed all of the staff at MGH to wear masks all the time? You're nodding in agreement. Is the supply of masks adequate?
So the supply of masks is adequate right now. Again, much like the governor said, we believe in orders when they're on our loading docks and we have them in hand. But we've been very carefully modeling and managing how we use masks. And what we've seen is because there's so much asymptomatic transmission, meaning people can have the infection and transmit it without any symptoms at all, that's why we felt we needed to take this step to protect our patients and our workforce.
What are you worried most about?
I'm still worried about the peak. I think, as was said, we're 2 to 3 weeks away probably from the peak, at least based on our own modeling. If we have a doubling of critical illness cases every 3 days, that's a lot of doubling between now and 3 weeks from now.
So as a layperson, even though I've been a patient at MGH, luckily, not luckily that I was a patient, but if you have to be a patient, it's a pretty good place to go. I would assume a viewer would say what I'm thinking, which is if MGH is worried about the surge, if MGH is worried about a shortage of supplies, what must be happening in lesser hospitals around the state and country? Is that a fair question?
Well, I think every hospital around the state is working as hard as we are to try and make sure they've got enough personal protective equipment to make sure they're ready. Within our healthcare system, Mass General Brigham, we're sharing resources, sharing best plans, and we're actually working with a number of other health systems. So I do think that everyone is all hands on deck, and people should understand how hard every hospital leadership is certainly working right now.
How worried are you about staff getting sick? As of Friday, I don't have today's numbers. I know there were more than 160 staff people at Boston hospitals who had been infected. I think more than 40 at MGH. How much of a concern is that, Doctor?
Yeah, so certainly, unfortunately, our number has gone up, but I'll tell you that we're looking extremely carefully at our healthcare worker illness, and what we're looking at is actually comparisons to what's happening in the community. So of all the healthcare workers we're testing, about 8 or 9% have had COVID, and that's compared with the testing in the community where 11% of everyone we test has COVID. And so those numbers are about comparable. We're also looking very closely at those who are working with COVID-positive patients versus those that are working away from patients with COVID. And so far, there's no difference in the rates of illness between those who are exposed and those who are not, which gives us confidence in the personal protective equipment we're using so far.
Your boss wrote a piece in the Boston Globe several days ago with Senator Ed Markey. He was also on Meet the Press with Chuck Todd, saying we have to be on a warlike footing. He didn't mean just your hospital. He meant everybody, federal government, et cetera. We need a Manhattan Project, a Redux, that kind of thing. As an observer of the federal government and a beneficiary on a good day of the federal government, are we on a warlike footing? Are people listening to Peter Slavin?
I think it all depends on how you mean. I think the warlike footing in terms of innovation in the technology and in the manufacturing sector is extraordinary. People are 3D printing face masks, gowns, things that we need right now. Pharmacies are using FDA recipes to make hand sanitizer. So in terms of everybody pitching in and innovating, absolutely. In terms of really transforming the manufacturing sector to make more N95 respirators, to make more gowns, to make ventilators, there's probably more we could be doing.
Go to bed and you wake up the next day and you see a headline in a paper that the President of the United States is bragging about how his ratings for his afternoon press conferences are greater than the finale of The Bachelor or Monday Night Football. What's your reaction as somebody who's struggling to keep people healthy and alive?
I mean, I think when I wake up in the morning, I'm finding myself planning the challenges that I know I have to face during the day, and I go to sleep the same way. I think, all of us are single-mindedly focused on what we need to try and do to meet this challenge. We are trying to double our intensive care unit capacity, double our ability to use ventilators from what we thought was our previous maximum, and that's really kind of all I'm thinking about when I'm waking up and going to sleep each night.
Are you convinced that you'll be ready if this peak is reached 8 days from now, 7th to the 17th?
I think right now, for everything we're modeling, we think we're going to be able to accommodate the peak for what we see, but with such a little margin of safety. I think, we really, really wish we had 20%, 50% more than what we have, because that would make me sleep better at night. But we're not there. We think we can accommodate it, but each day we're reassessing.
What if you can't accommodate it?
I mean, we will certainly do everything we can. We have ways to share resources across our network, across with others across the state. But, what we don't want to do, if there's anything we can do about it, is end up in a situation where we just don't have that next resource that's needed.
It's very hard for anybody, I think particularly someone who's worried day to day as you are, to look to the future. But at the end of the show, I'm going to have the pollster for the Boston Globe on. And one of the pieces of his poll that has been very underreported in my estimation is 17% of the people in Massachusetts say they're experiencing the most fear they've ever experienced in their lives. 3/4 of people are saying they're experiencing more fear or extreme fear or the most fear. That's not going to disappear on the day that coronavirus disappears, is it?
No, I mean, it's unquestionable that I think we've changed society in a lot of different ways as we've adapted to this pandemic. I really am thankful for everyone who is disrupting their lives right now for social distancing because that's saving lives. Everyone who responsibly stays home is helping to decrease the transmission of the virus in the community. That decreases the peak overload on the healthcare system. That lets us save more lives. But I think for a lot of people, social distancing is becoming social isolation. I notice that we're afraid of one another as germ carriers when we walk down the street, and it's going to take a while to undo those kinds of perceptions that have been evolving.
Is there good news? I read as I was coming out to the set, Italy is reporting the fewest new cases that they've had in 2 weeks. Is that good news for us?
There is good news. I mean, obviously, we will get through it. We will get past this wave. There's other great news. You know, the nurses, the frontline staff, our security officers, our buildings and grounds, our janitorial staff, they show up every single day and they are ready to care for patients. The individual acts of courage every single day are extraordinary and are really worth recognizing.
Doctor, thanks for your work and thanks to all your coworkers as well. I really appreciate your time.
Thank you.
Dr. Paul Biddinger.